Every day we encounter stressful situations, like our first day of school, meeting new people, or going through a job interview. In these situations, the body responds by activating our sympathetic nervous system. That's the system that diverts blood away from the organs like the intestines or the bladder, so that we can increase blood flow and energy to organs like the brain, heart, and muscles, which help us respond or cope. This is sometimes called the fight or flight response, because it's the same system that kept our ancestors safe in dangerous situations. Short bursts of stress are helpful, especially if the stress is addressed in a positive way, which often means with the help of a supportive social environment with parents, friends, or teachers that care. In fact, even a hug from a loved one can release hormones that ease the stress and make it more tolerable. In that situation, it's called tolerable stress. But if there's a stressful situation, like the loss of a parent, and there isn't a strong support structure to help cope with the stress, then the stress can persist, and it can have negative effects like insecurity, anger, and fatigue. And when the stress system gets activated repeatedly, like when a child experiences physical abuse or chronic neglect, and there's no supportive social environment, then the stress can be overwhelming and have a lasting biological impact. Basically, the brain and body adapt to chronic exposure to threat by developing a heightened alarm state, and the body feels threatened all the time, even after the threat is removed. This type of stress isn't tolerable, and when it becomes chronic, it's called toxic stress. The events that trigger toxic stress in children are called adverse childhood experiences. Symptoms of toxic stress include difficulty sleeping, anxiety, fearfulness, and irritability. And that's because their brains and bodies are functioning in toxic stress mode. In fact, students that have 4 or more adverse childhood experiences are over 30 times more likely to have behavioral issues or learning difficulties in the classroom. In addition, there can be significant biological effects, like an increased heart rate and blood pressure, and even dysregulation of the immune system, which can lead to more infections. In the long term, toxic stress has been linked to health problems like heart disease and cancer, as well as depression. The good news is identifying toxic stress early and connecting children and families with services they may need, like counselors and social workers, can help reduce the negative impact. Parents and teachers can help prepare children for stressful events by helping them build skills like relaxation techniques for managing stress. Because stress can be disruptive, having consistent routines throughout the day and being surrounded by supportive parents, teachers, and other caretakers can also help reverse the symptoms. Alright, let's quickly recap. Toxic stress occurs when a child experiences long-term stressful events in the absence of a protective environment. Toxic stress can have dramatic effects on the body and brain development and lead to psychological, behavioral, and learning problems. These complications can be prevented or reversed with the support of a caring environment with strong and consistent relationships with caring adults in the home or classroom.